Okay. Thank you. Good morning, all. It is an honor and privilege to be part of this conversation this morning, and I'm really grateful to Lupus Ascending for giving me the opportunity to participate in this conversation today, and also to give some of the insights from my professional view. My name is Ugbong Gabriel, a counseling psychologist with a master's degree specializing in trauma care. Uh, I think for me, the what drives me about this profession is wanting to be there for people in the aspect of recognizing the psychological wounds and psychological aspects of life that we usually take for granted, that we usually overlook. I believe in that the human person we need when addressing the human person we need to address them holistically. So the biological health is important, the psychological is important, and by extension the spiritual. And so I am lucky to be able to contribute in the psychological aspect, which is mental health, to the wellness of the human person. Therapy is something that has helped me in the past, and I am a very big champion of it. So I always try to be there for people, and I think that is why I have chosen this profession and to do counseling. So yeah, that is a bit about me. I reside here in Kenya, but I'm Nigerian by origin, but I've been in Kenya for the last 8 years plus. So I'm happy to be part of this conversation. Thank you. I think I can present from my end. If I'm not able to, then I would seek your assistance. Thank you. Okay. Our conversation today is about your mind with lupus. I just want us to know that the conversation today will be purely focused on the mind and how lupus maybe affect or impact on the mind. So we might not go into a lot of the medical terms in terms of the biological aspect. So just to let you know at the beginning. And maybe before I start, just to say that lupus is not just in the joints or the skin. It's will I say the disease that is in our memory, our thoughts, and our emotions. I will give a very personal story, maybe just before I begin. When I started, when I went to university to study, I have a background somehow in philosophy. Now we used to have a schoolmate that I think was usually ill, and once in a while she will miss school, and she was not in class and all that. And usually people will get to talk and to ask and to say, "Oh, what is happening? Akowapi, why is she not here?" Right? And usually the idea was, the conversation was, she has lupus. So it was the way it was being said around school. It's like it was a hush. We had to say it under waters. It's something like, when we talk about people who have maybe who have been diagnosed with HIV and AIDS, and the way we keep it hush hush, like something that should not happen. This was the conversation around school. So it was like something that shouldn't be talked about. And I remember that was my first time actually hearing about this. I should have been what? I should have been 22, 23. So imagine, it took me that many years to really know about lupus. But even when I heard about it, it was something as if that was like a taboo. And over the years, in my thoughts and everything, in my education, I've begun to realize that it shouldn't be the case, right? That there's a great gap um, in terms of the knowledge about what lupus is, and it should be conversation that we should have. People should be taught about, and people should know about these things that happen for us to be enlightened. And it shouldn't be something that we hide and talk about, but a good conversation. And I would say why this is important as we progress with our conversation today. I would like us to begin with the definition of the mind. Now, in philosophy of the mind, just bear with me. Let me go back to my philosophical background. There's a lot of question about what is the mind actually. Is the mind just the brain? Is the mind a spiritual aspect, a spiritual issue? What is the mind actually? And there are many debates around that. But I think for us here today, I would say the mind is a sense of mental faculties that include things like the consciousness, thoughts, emotions, perception, memory, and imagination that arise from and interact with the brain and the nervous system. So when we talk about the mind, it's not something purely uh, spiritual, not something entirely physical, but a combination of both. Uh, Let us think of the mind as the inner world of a person. How you think, how you remember, imagine, and how you make decisions. So it's a distinct aspect of every human person. Let me give you an analogy. When we look at the musical instrument, for those of us that love music, when we look at the musical instrument itself is not music, right? So the musical instrument like the guitar, the piano, that is not music, right? That is the instrument. But then the instrument produces the music. So we can think of the brain as the musical instrument, and then we can think of the mind as a product of the brain, as a product of the musical instrument. So the brain is a musical instrument, and then the mind is the music. If that, just to break it down and make us understand what we are doing here, and I will explain that as we go along. Now, what is lupus? It's an autoimmune disease. This means that the immune system, usually in our bodies, is supposed to protect us against diseases, against infections, and all other issues that come up. Now, when one is diagnosed with lupus, what happens is that the immune system begins to attack the body. So instead of protecting against foreign things that are coming into the body, like bacteria and infections, the immune system begins to attack tissues and organs within the body. And the most common of this is known as the systemic lupus erythematosus, with the short form SLE. And it affects many parts of the body, including the skin, the joints, the kidneys, the brain, the heart, and the lungs. Uh, so this is what happens when we talk about lupus. Now, there are many symptoms of lupus, and there's the biological aspect, which we have talked about, things like the kidneys, the heart, and the lungs. Also, then one of the other symptoms is the neuropsychiatric symptoms. Now, when we talk about the neuropsychiatric, we are referring to a wide range of cognitive, emotional, and neurological symptoms that occur when lupus affects the central or peripheral nervous system. Now, when we think of ourselves, we think of the brain, the nervous system. Actually, the nervous system is made up of the brain and the central nervous system. And so when we talk of the neuropsychiatric symptoms of lupus, it means that this affects aspects of the brain and the central nervous system. So it means that the lupus can indirectly attack the spinal cord, the peripheral nerves, through inflammation, antibodies, vascular damage. And so then you will find symptoms like depression or anxiety, or neurological signs like psychosis, which can be real organic manifestations of lupus. Now, it's important for us to note here that when we talk of lupus, we need to look at the organic manifestation, in the sense that how it affects the body itself, and also the psychological aspect of it, of symptoms that might arise. And it's something that I will expound as we go. Now, so you find that when the brain is affected, because let's remember, central nervous system is responsible for every aspect of our lives, the movement, cognition, emotions, and all that. So when lupus affects aspects of the brain, it affects the part that is responsible for cognition, which is the prefrontal cortex, which is responsible for thinking, for coordination, for decision making. And so when this aspect of the brain is somehow affected by the nerves that are being attacked by lupus, it can lead to things like memory loss. It can lead to confusion, to reduced attention, and to brain fog. Now, the prefrontal cortex is responsible for all these activities. And when that section of the brain is affected, this the cognition aspect of the human person is affected. Now, the other aspect of the brain that also is affected is the emotional aspect. And the part of the brain responsible for the emotional function in the human person is the amygdala and the orbitofrontal cortex. And so when this aspect is attacked and is not functioning properly, then there are things like depression, anxiety, mood swings, and psychosis that can come out of that. The neurological aspect, like the seizures, the stroke, and the peripheral neuropathy. Also, the other aspects of the brain that can be affected is the numbness, the tingling, the tremors, and the weakness. So we have things like the personality changes, hallucinations, and delusions. Now, I mentioned something about I had said something about the organic manifestation. When we talk about lupus and the neurological symptoms, it's always good to distinguish if a mental health condition arises as a result of the biological aspect of the brain that is being affected, or as a reaction to this. Let me give an example. We all know that for example, you are diagnosed with some health conditions. These conditions can cause a lot of anxiety, depression. So the issue is not just anxiety and depression. The main issue is the medical condition. But from this medical condition, it could lead to a pressure for you to have things like stress, depression, and anxiety. So people who are diagnosed with lupus can, because of the stress around going to the hospital frequently for medication and having to take a lot of medication, can begin to be stressed about that. And it can bring about things like depression, stress, anxiety. Also, the biological aspect is that when the brain is also affected itself, especially the aspect that I've mentioned, like the amygdala and the emotional aspect, it can also bring about emotional dysregulation and all that. So it's sometimes difficult to differentiate if aspects like depression, anxiety, stress, emotional dysregulation are as a result of the disease itself or a reaction to the disease. So it's a place that we need to be a little bit more conscious about, and in the treatment of the person, to be aware, to journey with them, to know what is happening, to know what is really the cause of this in the person. Now, people who undergo lupus treatment usually are placed on a lot of steroids that could cause flares, which can bring about mood swings and mania and all that, and chronic fatigue. So the medication itself that is prescribed, that they use to manage the situation, can also bring about inflammation or other aspects that can cause some mental health conditions and concerns in the person. Now, what is the psychological toll of all this? Remember, chronic illness can sometimes lead to emotional strain, especially with a condition like lupus, where it is not usually you are not usually sure when to expect it. Sometimes it comes up and it disappears for a while, goes into remission. Sometimes in few people it can go into remission forever, but for others it might come up again. So there's no time frame. It cannot really be monitored. And so something that is not so sure, something that is always there's no certainty, can bring about some emotional strain in people, in the sense that there's that anxiety and the stress of when is this going to come up. I don't know what is going to happen next. How long is this episode going to last? Is it going to be for a few days, for months, and all that? So there's an emotional strain that can come up from that. And remember, the emotional aspect of the person is also part of the mind. The other thing is the social isolation and stigma. As human beings, we are social beings, right? It means that we form relationships, and we are in relationships with people, our families, our close friends, the community, and all that. Go back to my story in the beginning about this student who was in school, and we were saying things about her and maybe hush because of the understanding of what the disease was. You see that this can make people then isolate, or can make people distance themselves from others because they do not understand what lupus is. And you know how fickle we human beings can be, in a sense that what we do not understand, we spread a lot of stories and wrong things about it, and then we begin to distance people and discriminate against them and put them aside from us. So when people begin to realize that we are treating them differently because of maybe being diagnosed with lupus, there's the tendency for them also maybe to isolate themselves from people, the community that does not understand them, or where there are usually a lot of negative questions and ideas and thoughts. And so the stigma and the isolation is one of the aspects that can lead to things like anxiety and stress. Because if we cannot socialize with people, then there's that aspect that it affects us psychologically. Uh, the other aspect that I've mentioned is the stress also about the condition can sometimes trigger episodes, the flares, that come in that come unplanned, so they can come anytime. So the stress can even trigger those episodes in when diagnosed with lupus. And the thing there is that you do not know when to expect it or how long it's going to last, and there's no certain cure for it. It's a situation that has to be managed sometimes for the rest of our lives, and that can be stressful for individuals that go through this difficulty. So even things like depression can weaken the immune system. And so it's important for us to realize that when we talk about lupus, we're not just talking about the biological symptoms that appear maybe in the kidneys, in the other aspects of the body with the ankles and all that, but it's also a psychological. There's a psychological aspect to it that we need to pay attention to, because if that happens, then it means that we will treat the person holistically. So we consider the biological and the physiological response, where we place them on medication for them to get better, but also there's the psychological aspect where we need to think about the mental health of the person, because it is important. We are treating all in unison and not just one aspect of it. We look at it holistically. And from my background as a trauma-informed care, that is where we talk about the holistic aspect of treating the person, of treating the physiological symptoms and the psychological symptoms, and by extension, maybe also the spiritual aspect of what is happening. So some of the treatment that comes up with those diagnosed with lupus is the medication, the antidepressants, the immunosuppressants, the steroids. Also, then there's psychotherapy, where we try to take the clients through effects of therapy. Maybe we could use the cognitive behavioral therapy to change their behaviors and thoughts and their perception of what they are going through as people. Remember, one of the aspects that is that could also be affected is the memory, which is and the part of the brain responsible for this is the hippocampus. So if that aspect of the brain is also attacked, then it means that memory within the person is something that can be affected, and such clients then has to be taken through memory work to be able to help them, the cognitive rehab, to help them through memory training. Then also the support networks. As people, like I have said earlier, we are social beings, and so it's important for us to understand that those who go through lupus are not just going through the physical aspect or the biological aspect, but also the psychological, and they need our support and help. They need us to understand what is really happening, how we can best support them, to understand that sometimes life might be rosy, but in the next minute or in the next few days, things can change. And so we do not misunderstand them. We do not think that people are making things up or they are lying about their situation, but to understand that these are issues that are very possible to happen. And when we understand what lupus is all about, and the presentations and the manifestations and the symptoms, then we can support them better. So we can become then the support networks to those who are going through such diagnosis in life. And also those who are going through the process can also use things like meditation and journaling to become aware, to express themselves, to keep track of what is happening in their life. Meditation is a relaxation technique that helps. And since stress is one of the most common things that come up in with those with lupus, meditation then brings some amount of calmness, some amount of relaxation, some amount of awareness and being in the present. So meditation is one of the things that we would prescribe and ask people to make use of as much as possible. Now, as we come to the end of this, maybe those on the call today, maybe some of us have been people that have been diagnosed with lupus. Maybe some of us are hearing about it for the first time, or we know about it. But one of the things I want to encourage us is that people who face this diagnosis need validation. We need to understand the wholeness, understand the symptoms in entirety for us to do what? To validate their feelings and not to play around and push them aside. We need compassion. I wish the world was a little bit more compassionate towards people that go through difficult situations. If I look at the story I gave at the beginning, in terms of how we talked about this student behind her back and in hushed tones, there was nothing compassionate about that, because it was almost as if there were rumors that were being spread and talking behind her back and not even going directly maybe to find out what is happening, why are you missing school and all that. So we need to be a little bit more compassionate to people who go through such difficulties. We need to support them as much as possible. We can do this by raising awareness. We can do this by being there for those who are going through this, and then there's the trauma informed care. And just to say that when we hear that someone has, there might be different manifestations when it comes to lupus. I'm not saying that those diagnosed with lupus, all of them would have these symptoms in terms of the mental aspect and the mind. But studies show that between 30 to 70% of people would usually come up with these neuropsychiatric symptoms. And so it's important for us then uh, to to be there for them and to give them the support that they deserve. And maybe just for us to, as before we round up, and just to say, what have we talked about in general? That when we talk about the mind, we are talking about the functions of, we are talking about the faculties that enable us to know about consciousness, to know about perception, to know about thinking, judgment, memory, and emotions. And when we think about all these are present in the brain. The brain is the instrument, the mind is the product of the brain. And so then some aspect then of the brain that can affect the mind will be the cognitive functions. When the prefrontal context, a part of the brain, is affected by the immune system, then you can lead to things like memory loss and brain fog and fatigue and even loss of concentration. Now, the amygdala, the part of the brain that is responsible for the emotional states, when this is also attacked and affected, it can lead to things like depression, anxiety, and irritability. It can also lead to emotional dysregulation and mood destabilization. So these are also part of the emotional states that can be affected. When we talk about other mental illnesses that can result as a result of the mind being affected, will be psychosis, hallucinations, and bipolar symptoms. And then we can look at stress and trauma, which in turn affect the brain's immune activity and can worsen the diseases. So when the doctor says that lupus affects the mind, they mean that lupus disrupts the processes by which a person thinks, feels, perceives, and understands themselves or the world. So when we talk about the mind, we talk about consciousness, perception, thinking, judgment, memory, and emotions. And all this can be tied down back to the brain. And the brain is the aspect that can be attacked by the immune system that is supposed to protect it. So this is how we can connect lupus with the mind. Um, to everyone who might be listening that might have been diagnosed with lupus, just to say that you're not invincible and you're not alone. And I'm glad that this organization is helping us to become aware of what is happening, because I feel that when few of us who are on this call are able to know about this, we can take this message to other people. And so we can become people that support and encourage those going through this difficult aspect. And it's with the condition of lupus, like I've said, it's not something that can be healed. It's something that sometimes come up, goes into remission, and then flares up again, goes into remission, and all that. And so it's important for us to know that healing is not always about the absence of pain, but somehow it's about the presence of connection, of compassion, and of being deeply seen. There's a prayer that I like the most, that always sticks with me, and I think it's important for us, especially those who might be walking this difficult journey. And it says, God grants me the serenity to accept the things I cannot change, courage to change the things that I can, and the wisdom to know the difference. I want to thank Lupus Ascending for this opportunity, and for allowing me to share my views and professional views about lupus and how it affects the mind. And I hope that I have been able to somehow make the connection and break this down for all of us. Thank you. Yeah, I think you are actually correct, actually, because you have mentioned that actually, you see, with the immune dysregulation, immune dysregulation or emotional dysregulation, you are talking about the imbalance, right, of the system, right? And so with this, you talk about things like the fatigue and not wanting being able to do certain things. Now the tricky part about this also is that immune dysregulation can also contribute to depression, right? And so there's a lot of resemblance there, but although they are not the same thing, right? Because when you look at the dysregulation, the you are looking about the altered white blood cells counts, the inflammatory and all that. But when you look at the depression itself, depression will be, so with the dysregulation there might be fatigue, you might not be have the energy and the going about tasks the way it is and how it's supposed to be. But when you look at depression more, you're looking at more of the psychological state, in the sense that there seem to be loss of interest. There seem to be a loss of interest in life, in the things that you are supposed to do, in even going on with life. So there's a sense of hopelessness. There can even be an aspect of anger turned back on yourself, and just a certain amount of anger that is there in terms of to life and things like that. So although they might resemble, you find that the clinical symptoms of depression will be a little bit different than that for the dysregulation and all that. So although the dysregulation could lead to something like depression, the depression will be something different. And that is why it's important, like I mentioned earlier, it's good to look for the clinical signs a little bit further to say, is this dysregulation or is this actually depression taking place in the person? Yeah. Yes. Okay. That's, yeah, treating the mind with lupus. Yeah. Yeah. Is that yes, treating with the mind in lupus? Can you see that on your end? Oh yeah, there are therapists who are actually trained specifically with certain aspects like CBT. So, for example, in the trauma informed work that I do, CBT will be part of it, in a sense that it's one of the tools and the techniques that we use. So it's you'll find a lot of therapists, if you look properly. Yes, they are in Kenya. So yeah, there are therapists that are trained in CBT. Or would you want me to explain what CBT is? Okay, there are a lot of good insurances within Kenya that cover for therapy, as long as the person you are meeting is a licensed therapist, and they have their licenses and registration with the board. Most insurance companies pay for therapy. Now, when we talk about CBT, we are talking about the cognitive behavioral therapy. Remember when I was talking about the parts of the brains that is sometimes affected, I looked at the cognition part, the emotions, and the behavioral. Now in CBT, what we do is that, like, you are trying to change to restructure the thinking patterns of the person, or the behavioral patterns of the person. um, So, for example, let me use depression. Since we have used depression, you have talked about depression. So, in depression, one of the symptoms that is always there is a sense of hopelessness. Um, so, for example, somebody going through lupus might go with this notion of maybe I am tired of life. Means nothing. Life is because of this diagnosis. My goal in life is to suffer, is to go through pain and all that. You see that those are the thinking patterns of the person. And so when you take this person through the CBT, what you want to let them know is, number one, maybe let them know what the impact of lupus on the cognitive aspect of the person. Let them know what the disease is all about, and let them know how in terms of science, how it happens in people. And so it happens in a few set of people. And so it's nothing about you being hopeless and useless or not being good enough and all that, but you want to let them know that the science says it happens one in two persons, and that even with the lupus, you can still go about your life as it should. So you are trying to change their pattern from a sense of hopelessness, seeing the end, don't want it to continue with life, but changing that pattern to see some amount of hope, to let them appreciate their life as it is and what they could do even with the diagnosis. So in that sense, you are changing the cognitive patterns of the client. In the behavioral pattern, we want to change some behaviors. So one example that comes to mind is addiction. So for example, one of the things that people at the beginning stage before they get into addiction, what they do is maybe they associate something with a certain behavior. So for example, I know that if I want to relieve stress, when I come back from work today, I just take a bottle of beer and I feel very nice. What happens over time is that maybe I can go from one bottle to two bottles to three bottles to four bottles. So anytime I am stressed, immediately I think about beer, I think about alcohol, and so it becomes a behavioral pattern that I have formed over time. And so for you to break that addiction, you want to change that behavior by then letting them know how they can associate. Uh, when it comes to stress, how can you handle stress that does not involve maybe drinking? So we need to change that behavior of drinking to relieve stress to maybe doing something different that can help you handle stress. So you are changing the behavior of always going to drink. So that is what CBT is all about. It's about changing the patterns in the cognitive and the behavioral aspect of the person to see how you can bring the change that you deserve or you want to see. I don't know if that answers, yeah, if that is clear enough. Yes, things like sublimation. Yes, you would want to change that so it to be in the behavioral aspect of it. To say, sometimes when we sublimate, what could be responsible for that? Could it be stress? Could it be as a response to something else? And you see how, rather than sublimating, how can you substitute that behavior for something more positive and something more healthy. So yeah, it's about changing the patterns in a person. Exactly. Yes. Okay. Okay. Maybe at the top of my head, a tool might not come to mind, but I know that one of the things we can always do is to check in with people. So, for example, when maybe in your interaction, in the great work that you do in terms of supporting and working with people with lupus, is to check in as much as possible, um, how they are doing, uh, and if maybe just to acknowledge what changes might be there for them as people. There's something that I learned also I learned in the course of my studies. It's about normalizing people's feelings and people's emotions. Usually, when people when someone does something, they know it's bad, right? So, for example, not bad, but challenging. So, someone might say, "Oh, I am trying to stop this addiction, but I know I said I was going to stop, but yesterday I went and I drank one bottle." Uh, you see, when someone tells you that there's something difficult about it that they are telling you about, they know that somehow they slipped in their commitment, and it's a struggle. So what you do is number one to say, by the way, in your journey towards healing, there can be this aspect of of slipping and falling down, and that is normal. But you pick yourself and you continue. You see, what you have done is you have normalized that. And so maybe someone can come and tell you, yesterday we made resolutions that even with what I'm facing, I'm going to go about my task and go do this and wake up and do that. But maybe the next morning they wake up and they're not able to do that thing that they set their mind to do. And somehow you normalize that and you tell them, okay, it's okay, that can happen and all that. And then you continue. So there's an aspect of normalizing the challenges and the struggles that people face. And then you encourage them from that aspect. So from the top of my head, that would be something that I think is important, that sometimes we take for granted. People say things and we let it go, or we rush to judge, or we rush to give advice and all that. But to normalize how they are feeling and the challenges they are going at that particular time, and then see how we can take it on from there. So I think the two things that come to mind would be to check in regularly how people are doing and all that, and to normalize what they are going through and assist them further. Uh, that would be something that I would say from the top of my head. Yeah, yeah. Your question was? Yes, thank you, Patience. Actually, I think the right word there would be acknowledgement. I think that was what I said when I said check in, maybe just to check in with the people and to see how they're doing. And I think it's important. The right word there, yes, will be to acknowledge what they are going through, and to say, yes, I see you. Actually, there's a greeting in Zulu. They say "Sawubona" in the morning when you see someone, and it says the meaning of that translation, literally, Sawubona is "I see you." And so I think, yes, patience, what you have said is important to understand, to acknowledge, to say, I hear you, I see you, and I tend to recognize the difficulty that you are going through. And thank you for that. That is really important. I think I'll reserve my questions for last, and I'm open to any question that anyone might have.
Oh, thank you. And thank you, Gabriel, again. My question is, um, since with lupus you can't tell when a flare is coming, or uh, where even let's say the funding is coming from, for the medications, to see the doctor, etc., etc. Um, would lupus be classified as a traumatic experience for somebody? Because you never know. You don't know how you're going to wake up. You don't know how the next hour is going to be. Would that classify at all?
Okay, Doreen, thank you for that question. And I think that is very important. And I think somewhere in my presentation, I mentioned about trauma-informed care. I think maybe as I answer that question, let me begin with the general acceptable definition for trauma. And I think usually we define trauma as an event or experience that one experiences that is life threatening, and that has an adverse effect. So there's the experience, there's the aspect of the life-threatening aspect of it, the impact on your health, and also the how long it is. So with that definition, we can say yes, lupus is something that can be traumatic, and not for everybody, because trauma is subjective, in the sense that what is traumatic for me as a person might not be traumatic for the other person. So when we look at the diagnosis itself, the seriousness, and how it can be life-threatening, in the sense that it can bring up a whole lot of symptoms and issues. It can be traumatic for some people. So yes, the question will be yes. Lupus can be traumatic for some people who experience it, and so which means that in the care that we offer, then we need to use the trauma-informed approach then to help them handle this life-threatening experience that they are going through, and how it's affecting their health, their relationship with other people, their aspirations for life, and so on. So yes, Dory.
Okay, with that said, um, what if the lupus patient is not able to access psychological care? Like they say a counselor or something like that. So what can the person do, or what can the support system do, the caregiver, for example?
Okay, I think that is a good question. Unfortunately, the health system in our country today, let me say maybe in Africa in general, sometimes we neglect mental health, or that the funding is not really there, and so it's not really accessible to people. So one of the things that as people, even without going to therapy, that we have is the coping strategies that we have internally and around us. So the internal coping mechanisms would be maybe like the encouragement and the resilience and being some amount of hope to know that I can go through this. And it can be somehow draining sometimes, that sometimes you might not see the hope, and that is where the external help and coping come in, because in those days when it's difficult for you, then your family members and the people around you can become the support system, can encourage you, can be there for you, can realize that today you might not be up to a task, so I need to help you. And so it is very important then for us to educate people around us about the effects of lupus, especially psychologically, so that we can then be there, offer that social support in a situation where someone will not be able to attend therapy. So without therapy, what comes to my mind would be coping mechanisms, both internally and externally. And externally will be the family, the friends, the relatives, your community, church organizations, how we can support you, even an organization like this, to maybe have support groups and all that for people who are going through this, and maybe the internal mechanisms of resilience, of hope, of encouragement. That is what I would say, without the presence, without in the absence of therapy.
Okay, one more question.
Yeah.
It's about the doctor-patient relationship. So, when somebody is diagnosed with lupus, I can
Okay.
give myself as an example. When I was diagnosed with lupus, I was about 15, and the funny thing is that the doctor mentioned that because I had lupus when I was very young, that um, it would be, I would not, it's possible that I couldn't reach to the age of 30. And if I did reach to the age of 30, then life would be very difficult for me. So, um, unfortunately, doctors, or some doctors anyway, tend to do that to lupus patients who are
Yeah.
newly diagnosed. So, my question is, can that also contribute um, what to a sense of defeat in the mind of the lupus warrior or even the lupus supporter? Because the doctor is saying that there's no hope basically for you. They've told you there's no cure. They've told you there's no possibility to live a normal life. So, does the doctor also hold some responsibility? Is my
Oh
question.
yes, actually, I agree with you. Yes, the caregiver plays a very big role, especially at the point of informing the client or the patient about the diagnosis, and so you find that, and some it's something that people need to be trained about giving information. So I'll give an example. In some countries, you find that when there's an issue of death, when a relative or a friend has passed on, uh, the doctor does not come to you and tell you the patient has passed on. What they do is maybe they hand it over to a psychologist or a psychiatrist to pass that information, because they will be trained on how to pass such information. So, number one, the way the information is passed is important, because you can either bring about despair, or you can encourage hope. And that brings me to the second aspect of it. The second aspect of it is that studies show that people live with lupus for a longer time, so not just 30 years. There are some whom the remission goes and goes forever, right? And so it's important for the doctor to highlight all these scientific findings and all these scientific facts when giving those information. So to say that this is the condition, this is how it is, but there are chances of this, and that, and if we were to give treatment and to monitor it, there are chances that this will be the case. So rather than focusing on the negative aspect of it, it is always good also to highlight the positive aspect, the positiveness, in the sense that there are people who can live with it for a longer time, over 30, as studies show. There are people whom it goes into remission far uh, well into life. And so the doctor and the person who passes that information needs to learn how to pass that information, because they can either encourage or they can buttress, and they can kill hope, any sense of hope in that. And I really want to will I say apologize, or just to say it must have been difficult for the doctor at the age of 18, and it shouldn't be that way. There should have been a more professional aspect and way information to the client. So yes, the doctor plays an important role in the whole aspect of passing the information to the client.
Um,
Maureen, does that answer your question?
it does. And then it's making me think of
All right.
we had an event here where Dr. Migoa, because she deals
Okay.
with lupus in children, and she was talking about lupus sometimes can show up in a child as young as 3 years old. So, with all these things about the mind, and we have a young warrior who has lupus, then how can we effectively support this person? And especially the ones who are very young and they cannot contextualize what is happening with them or to them. So, what do we do?
Sorry, come again. I didn't get the first part. You were breaking off. Sorry. Can I get the first part of the question
No, it's
again?
okay. I can go again. So, we had an event
Okay.
where a pediatric rheumatologist was saying that sometimes lupus can show up in a child as young as 3 years old. So, with all these things about the mind, now when a warrior is very young and they cannot
Mhm.
contextualize or even just tell us what exactly is happening with them, how they're feeling, what they're feeling, uh, what do we do for this particular warrior? And even as a caregiver, how do we intervene? Because they can't tell us exactly what is happening. We can only see it for ourselves.
Oh, okay. Yeah. Thank you for that. That is very important. I think when it happens to young warriors, as children, it's usually difficult for them to be able to express themselves, especially with the years that you've mentioned, around 3, 4, 5 years thereabout. And so the people that are very, very much important at that particular that element of life need to be a little bit more aware, to be a little bit more conscious about the changes that might be happening within this around the kid. And they can then handle the kid in a better way. So at the early stages, especially, oh, sorry. Yeah, hello. Yes, 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 I can hear you. Oh, sorry. I think that was the network issue. Okay, staying earlier on that for the younger warriors, okay, for the younger warriors, the caregivers are the most important aspect, because the caregivers need to be educated about the symptoms, how they show up, and all that, and they need to take care of the kid, and then we take them for help and medical assistance and all that. As the kid progresses, then you want to educate the kids about the minor things. For example, about pain, about maybe tiredness and fatigue. If you feel this way, let me know. Tell me when you are feeling this way. When the kid is growing up to a state of maybe where they can express themselves, then you encourage them to do that. But for a younger kid, the caregivers are the most important part in that sense. Hello.
Hello, I understand that part. However, for a
Okay.
younger warrior, if the
Yeah.
caregiver is also in a state of hopelessness and depression, so how can the caregiver help the child?
Okay. Okay. there's something Edward mentioned earlier on, which is very important. He said something about compassion fatigue, in a sense that compassion fatigue, if we were to explain it in a very we can become overwhelmed with that care. It can be very demanding, and then maybe it can lead to a whole lot of other things. So, like you've mentioned, that if the carer is also facing things like maybe depression and all that, they would need to get help, because at that moment there will be the adult in that relationship, in that ecosystem. They will need to get a little bit of help, and so which means that organizations and groups that support lupus warriors need to take into account the well-being of the caregivers, and that programs are not just organized around those who are fighting the diagnosis, but also those who take care of those people, to see how they can empower them and let them give better support. And by extension, sometimes there's what we call child therapy. It means that if you can afford therapy, then that kid could also go for child therapy to see how they could be helped in a sense. So there'll be specialists around that area, around child therapists, which is not up for everybody. And so if the children can go for therapy, then they can where you have a support group for those who are taking care of maybe people with lupus, then they can get that help, especially if they are going through those difficulties of anxiety, depression, and maybe fatigue. They can be helped in that way.
Okay, thank you, Gabriel. I appreciate.
Okay, yeah, that is a very good question, Patience. The compassion fatigue would be more of those who take care of the clients. The patient themselves can be overwhelmed with maybe the support and the compassion that people show. I think the compassion fatigue, in my understanding, will be more from the side of the caregivers. But you see, those who are going through this can be overwhelmed with the attention that this is bringing, and the empathy that comes with it, and in terms of I'm looking for the right word. So the compassion fatigue will be more the diagnosis can be overwhelmed with, especially with the attention and the empathy that comes on and all that. And yeah, so that would be something that they feel, but I wouldn't term that as a compassion fatigue. Does that answer your question, Patience?
I have one more question. Sorry. Um, in as much as we empower the lupus warriors, right? And also their caregivers, is it also important that you find a way that we now start putting more attention on the society? Because we can empower the warriors themselves, but then they go out to the society and then they're met with harshness, and ridicule. So is it more important that we educate the society more than the lupus warrior?
I think that is very wonderful. I think you can go back to the story that I gave in the beginning, right? About the how we, in my experience, we're talking about lupus as if it was something that shouldn't be mentioned in public. It was something very so strange and all that, and that's because the public knowledge about people do not know about it. And so it's important then that society has to be educated more about what lupus is and the symptoms and the impact of it, so that we can also become more enlightened in our dealings with other people. So yes, it's very, very important for society to to uh, to know, because like you're saying, the lupus warriors might know all about it, but when they go out there and they face discrimination, then that can also hurt. And so it's important that the public perception in terms of public health education awareness needs to be created for people to know more about what this is and how we can support people. So that is very important. It's an important aspect of the ecosystem, because if you look at it as an ecosystem in whole, if you educate one part of the ecosystem without the other part, there's going to be an imbalance. And so there's need for us to educate the whole ecosystem. So the warriors, the caregivers, and then the society at large. If we can educate the whole ecosystem about what lupus is and the manifestations and the symptoms, then it's going to be a much better world for all of us. And so for me, I'm not the same person I was 10 years ago when I first heard about lupus and the way it was talked about uh, under the water. Here we say Chinyamaji. Here I am a little bit more educated, and through an organization like this, we can give voice to more people and to educate more people about what lupus is and how we can support people. So yes, thank you for that question, and it's very important.
Thank you. Thank you.
Thank you very much. I'm really grateful to Lupus Ascending for giving me this opportunity to be part of this conversation. I am going to, like Doreen has said, in my own part, in my own way, is to continue raising awareness of what lupus is, and to the community, and to do my own part. And I hope that we all can do the little that we can to educate people around us around what lupus is, and how we can support people around those diagnosed with this. So I'm grateful. Thank you for this opportunity, and may God bless you in the work that you do. And to all those who listen, thank you very much.